Now, Namibia is quietly facing a mental health emergency that is claiming lives almost on a daily basis, now dimming futures and impacting communities, especially among the youth. Now, behind every suicide statistic or a silent breakdown is a human life, a dream shattered, and a voice that went silent. Now, to talk to us more on this, we are joined, that is, by Dr. Querida Shivolo, a medical officer at the Mental Health Clinic of Windhoek Central Hospital. Doctor, welcome to Namibia Connect.
Thank you so much. It's a pleasure being here.
All right. Thank you so much for taking time to speak to us on this important topic. Of course, so we just experienced that with the high school student that committed suicide recently. Just firstly, how concerning is mental health matters in Namibia?
So I think we've reached a point, a critical point in terms of mental health issues in Namibia. We see that a lot of people are facing crisis. Every day we see the statistics, and this is usually among the population of men and then also the youth. We see it with substance use, we see it them having depression, self-harm tendencies, and suicidal ideation. So it's quite a concern. So this is not just a personal issue, it's not just a social issue, but it's also a national issue.
Indeed. Now, what is the estimated prevalence of mental issues that is in Namibia, and how does it compare to other countries in Africa?
Okay, so the data that we have is local data. The statistics currently, as we know, was reported that 543 deaths were recorded or deaths due to suicide in the financial year 2023 to 2024. And compared to other African countries, we also noticed that this is quite high. WHO did state that we are in the top 10 of high suicide rates on the African continent. And this is quite concerning. We also noticed that according to local news, we saw that in the first week of January alone, we had 7 suicides just in that first week. And every day it's a continuous thing. So we lose a life every day. It's tragic. It's a very high number because we are a small country and that is disproportionate to other African countries. So this is why it is important that we have these conversations like the ones that we're having right now to raise awareness and basically to help in prevention.
Doctor, we have various mental health conditions facing Namibians, of course. Now, can you highlight some of the most common, that is, mental health conditions affecting many Namibians?
Yes, so in Namibia, we've seen a lot of depression. We've seen a lot of anxiety disorders, panic disorders, PTSD. We also have mental conditions such as bipolar mood disorder and schizophrenia. And then we've also noticed there's an increase in adults who present with adult onset ADHD. So there are different symptoms that they come with. So a person can look happy, but they're still depressed. There are different types of depression, typical and atypical types of depression. So we also see that there are changes in your appetite, changes in your mood, irritability at work, for example. These are all symptoms whereby are very common in these mental health conditions. And across all these mental health conditions, we've noticed that suicide is common. So you can have suicidal ideation in depression, you can have it in bipolar mood disorder, you can have it in anxiety disorders. That is the common factor, and that is the issue that we're currently dealing with.
Doctor, how accessible are mental health services in Namibia now, especially in rural areas?
Okay, so we still have quite a long way to go in terms of rural areas because it is very limited mental health conditions, and there are different reasons and challenges as to why it is limited. It could be because of rigidity in the different regions. It could be workforce that is less. It could be people attributing mental health illnesses to cultural beliefs or religious beliefs. So there is quite less workforce in terms of rural Namibia. But then in Windhoek and Oshakati specifically, and the coastal areas of Namibia, we do have specialized mental health services available for everyone. And while we are trying to decentralize and incorporate mental health care in different primary across different primary healthcare centers, we still have a very good referral system whereby anyone in rural Namibia can be referred to us in Windhoek, because we are the tertiary institute whereby we treat mental health conditions. So our referral systems are very good.
Okay. Now, on policy level, what policies or initiatives has the Namibian government implemented to address mental health, and how effective have they been?
Okay, so the government has been working very hard. Ministry of Health and Social Services have been facilitating a lot of different types of mental health program campaigns, outreaches. So there is a policy, the Mental Health Act, that is currently being incorporated. So this basically just, it helps in terms of integrating primary health at different levels. And then it also facilitates all multidisciplinary teams. So when I talk about multidisciplinary, I mean doctors, psychiatrists, social workers, psychologists, occupational therapists are being facilitated by Ministry of Health, where we go out at small rural areas and do campaigns to raise awareness, and not just rural areas, also our neighboring towns. Recently in September 2025, we had an outreach where we taught PFA. PFA is psychology first aid, where you basically just teach, we taught the life skills teachers how to see alarming signs in the youth when they have situations at school that might be detrimental to their mental health. So the government has been having ongoing strategies, and the strategies really help. We see better referral pathways, we see better people, we see people coming to our facility not being scared or afraid to be discriminated against. We've also, with this policies and this type of training, we've also been training other doctors in other areas of Namibia to have the basic approach to mental health issues, so that it's easier for us to have that cohesive treatment.
Doctor, what would you say is perhaps some difficulties in terms of people seeking help, especially among men, because we keep preaching, we keep talking, but we know it's still going high.
Yes.
What could be the barriers, and how can people break those barriers to seek help?
So there are multiple barriers, from psychological, social, financial. They are very different. But most commonly, we've seen that discrimination and stigma is one of the biggest barriers. People are afraid to speak up because they're afraid to be discriminated against. And that is the culture that we have developed in Namibia, whereby we take Namibian men for what they can provide and not really think about their emotions. Also, the youth, we have we need to understand that we have different generations, and right now the youth is most predominantly Generation Z. So there are different ways that we can speak to them so that we lighten the blow, because right now we know that exam results came out, and it is a very difficult thing for some people to cope with failing, or some people to cope with not doing the best. So we need to know how to soften the blow, speak to them properly, allow them to have a safe space. Another barrier that we've noticed is also the religious and cultural barrier. So some people do not believe that mental health issues exist. They attribute it mostly to maybe a religious issue or a cultural issue, or spiritual for that matter. So it is very difficult to integrate into the mindsets of those type of people. We've also noticed rigidity amongst the healthcare workers in itself. Some people are very amongst mental health professionals, they have this rigidity of treating patients with mental health conditions, and they always just refer instead of treating them at that time. So when we have these barriers, it delays the process of people seeking help. It delays the process of people seeking help in time, so that we can prevent a crisis, so that we don't just come when it's too late. And the ways that we can break the barriers is to have more conversations like how we're having right now, raise awareness, have awareness campaigns, also teach faith-based institutes, for example, how to observe for the red flags and refer appropriately to us. If all of us are educated in the country, we can be a source for someone. We can be that, that miracle the person needed, just so that they can reach out to a mental health institute.
Any last words before we let you go?
So my last words is anyone who's currently struggling with mental health issues, they should speak out, right? Speaking out is basically a form of courage. It is not a form of weakness. So if you speak out, there is someone to lighten the load. We are here, we are available. If a person is not comfortable talking to maybe their parents, we are here at Mental Health Center, Windhoek Central Hospital, and we have a multidisciplinary team whereby whatever is being spoken about is confidential, but we will make sure that the person gets specific help. So reach out to whoever, reach out to us. We are here to help.
It's a collective effort.
It's a collective effort, yes.